Good afternoon. It is May 27th, 2021, and it's time for the weekly update about the status of Nevada County, both with COVID and more importantly with the vaccine. So, Ryan, you're on.
Sure, I'll just give some quick updates first on the case rates in Nevada County, and that's where we have some very good news. Our case rates are down at long last. We had just 30 cases last week, which is the lowest we've had since late September. And if you go back just a few weeks ago, where much of the state was seeing a reduction in case rates, and yet Nevada County was still seeing significant numbers and outbreaks among vulnerable populations, it's definitely a welcome relief to see that declining. And if people who are listening are not aware, we hit the first week of criteria for the orange tier on Tuesday, which means that if we do so again next week, we would advance to orange the following Wednesday. So that would give our businesses at least 2 weeks of being opened at a greater level prior to the June 15th reopening. So that's a relief to me, because I'm looking forward to seeing the new Quiet Place movie in theaters. That's not an endorsement, but that's just me. And then B, because it was a little bit scary to have the idea of going from significant transmission and outbreaks to June 15th and having almost no restrictions in place. And so it's much more comfortable to see our cases declining in advance of June 15th. And what June 15th means, for those who aren't aware, is that the state has messaged they will be retiring the blueprint for a safer economy, which includes in it capacity limitations, social distancing requirements, and that kind of thing. And instead, there will be recommendations, and then there will be some limited requirements that remain. Those apply mostly to very large events. That's events over 5,000 indoors and over 10,000 outdoors. We'll have some remaining restrictions, and then there will continue to be masking requirements, which will then mirror the CDC guidelines, which will be encapsulated into the state's requirements. And so at the present moment, that means that unvaccinated people would be able to be maskless in most places, and vaccinated people vaccinated people would be able to be maskless in most settings, and unvaccinated people would continue to be required to wear masks in most settings. So that's what's coming up on June 15th. A little bit about vaccination. So we're currently at 85,000 vaccinations, and I wanted to take a moment, if I may, Pascal, just to share screen and reflect back on a chart that I presented early in the vaccine administration. The chart on the left shows really to demonstrate public health's role in typical vaccination, what a typical flu vaccine year looks like. And you can see out of approximately 45,000 flu vaccines that are administered in Nevada County, public health administers only around 1,200, or 3% of those. We largely function as connectors and facilitators of vaccination, not direct vaccinators. But through the first 6 months of this vaccine effort, I'm proud to report that the public health team, under the leadership of Scott and Glennah and Jill Blake and Cindy Wilson and our great nursing team, has administered 22,000 vaccines out of just around 85,000 as of today administered in Nevada County. And that's 26% of the total vaccines administered in Nevada County, compared to 3% in a normal year with the flu vaccine. So very proud of that. At the same time, we want people to continue getting vaccinated, because we're just over 50% of the population over 12 has had at least one shot, and that's not nearly close or not nearly the level we need to achieve herd immunity. And so we definitely are pulling out all the stops to get the remaining people vaccinated and make it as easy as possible. So I think I'll stop there and give others a chance to speak.
And the others would be our two physicians here. So go ahead.
So a lot of people are asking what is going to happen on June 15. And as Ryan has said, there aren't going to be mandates. There will be recommendations, except in a few instances. For example, what the state is calling mega events. So conventions where there are 5,000 or more people, there will be some recommendations for testing and checking for vaccinations. etc. But the truth is the virus will still be with us. And some folks are going to feel that they aren't ready to give up masking and social distancing, and that would be fine. I think we should each make our own risk assessment, and those of us who don't feel comfortable just going maskless everywhere, even if we're fully vaccinated, should feel perfectly comfortable doing what makes us feel safe. As the risk of encountering the virus goes down because more people are vaccinated, I think we will be able to do more things. And I'm hoping that the folks who are not vaccinated yet will choose to be so when they realize how much freedom it will give, not just themselves, but their loved ones, to know that they're vaccinated and that they are very unlikely to give somebody who, for example, might be immunocompromised this virus that could kill them. So yes, the mandates go away June 15, the virus does not. And so we have to continue to be very careful. And of course, if someone were unfortunately to come down with the virus, we still want them to isolate, to talk with our case investigators, to be sure to let their contacts know and allow and work with us on contact tracing to prevent the spread of this virus to people who are not vaccinated. I think I'll stop there and see if Scott has anything else to add.
Thanks, Glennah. You rock. Actually, as an aside, your name came up just a few minutes ago. A guy named George Meyer is visiting, friend of Glennah and a classmate of mine. We went to high school together and then on to med school. So it was really neat. But I was just at Whispering Pines before I came over here, and I was talking to a 13, 14-year-old kid there, and mom sitting next to her, and I talked to the mom. I said, you know, how did you happen to encourage your child to come in? And the mom said, she pointed to the kid, and the kid did it. The kid wanted an immunization, wanted to socialize, wanted to get out. And so the upshot was that the kid had convinced the parent to be immunized. So we'd encourage more of that. I've been talking to a few pastors. They're really excited about getting back into church and having choirs belted out. I think there will be an encouragement to wear a mask if it's not well ventilated indoor. But the prescriptions are, if you have less than 5,000 per service, you don't have to really worry about much. So most pastors feel like they can fit within those guidelines. And last but not least is, you know, we are moving into the orange tier. And the good news about the orange tier is that it's a product of hard work. Everybody's pulled together. They're followed guidelines and they're being immunized. And that's the reason we're moving into the orange tier. So shout out to everybody in Nevada County who has contributed to the cause and looked at this virus as something that knows no boundaries, knows no borders, and can affect us all. So it's a common enemy. So thanks.
Thank you, Scott. And I see that Jeff Santos from Truckee is joining us. Hey, welcome.
Hello, yes, thank you. And sorry for being tardy. I was on another call, but thank you for having me.
That is absolutely fine. And thanks for joining us. So how are things going up on the east side?
As far as school district wise, things seem to be going well, knock on wood. We again we're in person school, have been for a number of weeks now. We did have a pretty decent spike in positive cases at our local Truckee High School. But due to our mitigation measures, we were able to really contain it through our contact tracing and the work of our nurses and working with public health. And I think currently our numbers are in the single digits as far as positive cases. We have a couple of classes at our elementary level who are in quarantine, pivoted back to distance learning, but yeah, things seem to be going fairly well.
Great, thank you. That's good to hear. And hopefully very soon, normal activities shall resume, including all in-person classes, because just to give the parents a break. I've heard from some parents, they are more than excited about that. So questions that we received was, one was more of a comment, and it's somebody went to their doctor's office and they were asked what kind of vitamins they were taking, but not if they were vaccinated or not. And so they're wondering if there is an outreach to physicians and healthcare professionals to reach more of them, so that this question, if people want the vaccine, if they are vaccinated or if they want the vaccine, if that can be incorporated just into the standard, while they're taking your blood pressure and measuring your oxygen levels. And I believe that public health, that you are reaching out to the various physicians. But maybe you can talk a little bit about that.
Every Friday we meet with quite a few of the docs in town, most of them primary care. And Ryan, you got your little graph of what it looks like to be normal with respect to immunizations. But we're trying, that's the way immunizations are traditionally being given. The role of public health, as Ryan mentioned, 3%. That 3% is marginalized. That's where we go. That's what public health does. Most people get immunized, some in the pharmacy, but certainly in their physician's office. And we certainly are, vitamin D is real important. It's part of the immune modulator. So we encourage people to take vitamins, but we look like we would like to roll this whole immunization program over to the primary care docs where they're receiving their care, and it'll just be part of a regular visit. And I think that's a result of a successful program, not mass vax clinics, but what we traditionally do.
I think your viewer makes a good point, and we will definitely recommend to our providers in Nevada County that they do ask about vaccination status right now. That's a good idea. And we are hoping that the vaccines will be available to doctors so that they can have them in their offices and give it to their patients. And we are working towards that goal.
Great. Yeah, I think it was interesting because a lot of times it was like, oh, well, don't you have no right to ask my vaccine status, but there are people who actually really want to get the word out. And I thought it was interesting that it was basically a patient saying, hey, the doctors, do more. So that's pretty interesting. Another question that came in, and since we are on the cusp of a holiday weekend, what about people? Can people who are visiting from other countries get a vaccine in Nevada County? Is that an option? Or can they even come to the U.S. Unvaccinated? But if they do, can they get a vaccine in Nevada County?
As far as I know, we're not really asking for residency requirements. If someone were to show up at one of our clinics, and currently we have both the Whispering Pines Clinic and the Sierra College Clinic open. If someone shows up and they haven't been vaccinated and they want a dose of the vaccine, hopefully they can stick around to get the second dose and be fully vaccinated. As far as I know, we're not asking for residency requirements at this point. Ryan or Scott, do you have anything else to add?
That's my understanding also. Glenn and I were talking about Concourse D at the Miami airport is where people are flying in from Central and South America and getting a immunization of Johnson & Johnson and then flying home. So, that bespeaks the fact that we need to be very judicious about the way we use immunizations here, and please be immunized. The people are flying all the way from South America just so they can get a poke. You certainly can drive to your local pharmacy or Western Sierra, or certainly Whispering Pines.
So while we were talking, I just went out to my turn to see if I could register for an appointment. And currently it does make you select a county in California in order to register through my turn. So you would either need to pick a county. You could probably pick Nevada County or just do a walk-in. We have so many appointments. I would encourage anybody who wants a vaccine to just come in and get one and not worry too much about that.
And that I think that's the issue. We have plenty of appointments and we would like to use them all.
Yeah.
So we would encourage everybody who has not yet been vaccinated to come in and get a vaccine. In fact, our Sierra College vaccination clinic has been so underutilized that it is likely to be closing on June 5th. So get over there before that. You will still be able to get a second dose at our Whispering Pines clinic, but yes, we don't want doses to expire without being used. So please come in and get vaccinated.
And just to clarify, that's the Western County Grass Valley Sierra College campus. I'm not sure if the Truckee Sierra College campus is still being utilized by Tahoe Forest Hospital, but we're talking about the state resource that's in Grass Valley.
Thank you, Ryan, for that. Yeah, I was going to make a note, but that's good to know. Thank you.
And also, it's not just that the people that you have walk-in appointments available at the public health clinics. You also have the amazing REACH team that is going and actually can go and vaccinate people that are either homebound or don't want to drive, or I mean, theoretically, could somebody organize a immunization party and have a REACH team come out and vaccinate a bunch of people? Is that an option?
It might be. I would definitely ask them to coordinate with Cindy Wilson, who is our nurse manager. But all options are on the table. I think we would consider anything in order to get more people vaccinated.
Yeah, I think the REACH team's going up to Truckee in the next couple of days, and mobile home parks, and in areas where people are less mobile, have less access to information technology and a computer. That's where we're going to go. And the REACH team is very mobile and very interested in helping out.
I would suggest that if there's going to be a REACH team party, or if there's going to be a vaccination party, the presumption would be that the folks that are partying are not vaccinated. So masking and social distancing would probably be advisable so that we don't cause an outbreak at the same time as we're vaccinating.
And I just got a text message from somebody who said instead of a party, the REACH team should just go and either go to Bridgeport or to some of the river crossings and just offer it there. It's outdoors, no mask required, but they could certainly jab quite a few arms.
Yep, no mask and no clothes.
No comment. I believe they talked about. I believe they talked about Bridgeport, which, if I'm not mistaken, is not like a certain beach at Purton Crossing, but that's a disguise. That's something that falls more under emergency preparedness and wildfire awareness. That webinar, by the way, is today at 5 o'clock.
Thanks for that clarification.
Another question that came up is again, and I believe we talked about that probably last Thursday when we had all these amazing pediatricians on. If can anyone for childcare? I think the last time around it was teachers, but this time it's like, can parents ask if the childcare provider is vaccinated, or can they volunteer the information? Can a childcare provider volunteer the information? I would assume volunteering is fine, but can people ask if their childcare provider is vaccinated, yes or no?
Yes, they can ask. I think there is a misconception that somehow it's intrusive to ask if people are vaccinated. But truly, if people who are vaccinated can do things that people who are not vaccinated can't, and that's mostly meeting indoors without a mask, etc., we're going to have a way of asking people if they're vaccinated or not. And I think it's best if we all agree that we will just volunteer that information. But if people don't volunteer it, and it's my child, and I'm worried about my child's welfare, and my child is under 12 and can't be vaccinated yet, absolutely, I think parents should ask and have a right to ask if their provider is vaccinated or not.
And current regulations are, we're still in the red tier. You know, if you have a gathering of people and if everybody's immunized, you really don't have to wear a mask. I mean, according to CDC guidelines, but you want to know, you know, do you have to worry? You know, I think masks are not a bad thing to wear anyway, but I think you have a right to ask. What, you know, they have a right to not tell you. But it's certainly, I think we need to begin the conversation.
I think people get confused because I think there are challenges and complications when you're talking about sort of an employer-employee relationship and how you manage asking employees if they're vaccinated. But in your private life, you're totally empowered to do that and protect your family in whatever way you feel is needed. And I would say on the workplace side of things, I understand that Cal OSHA will be coming out with guidance for how to manage that situation in the workplaces. On June 3rd is when they're voting on it, and then it'll be effective on the 15th in coordination with the state's shift to mirror the CDC guidance.
And those are long awaited. The OSHA rules are long awaited. I mean, we heard about those. They were in May. Well, no, even before May. I mean, March they promised an update and nothing happened. But glad to hear they're finally coming out. And we have a question: are physicians recommending that those who have had COVID get vaccinated? And I believe the answer is yes.
Yes, I think there's a little bit of confusion in that if you have had COVID, you can get vaccinated anytime after you're out of isolation and feeling better. However, if you had COVID and you were treated with monoclonal antibodies or with convalescent plasma, then the recommendation is that you wait for 90 days until after you got those treatments, because those treatments might interfere with the immune response to the vaccine. And I think people get confused thinking that if you had COVID, you shouldn't get vaccinated. But the truth is, if you had COVID, you get vaccinated. And even if you had those monoclonal antibodies, you can still get vaccinated, but it's best to wait for 90 days afterwards. Hopefully, I'm not confusing anybody with that.
Well, it's pretty easy. You had COVID, yes, get vaccinated at the latest 90 days after your treatment was over. So no, that's pretty clear. So 3 months after treatment, and that means that 4 months after that you're in the clear. That's pretty good. And I also the last time when we talked about that, it was also that actually if you had COVID, you do not, the immunization gives you more antibodies than just the quote unquote classic COVID infection if you just had COVID.
That's correct. We think that maybe the antibodies last longer with the vaccine than with the natural infection. And also there is now some reliable evidence that some people with long COVID actually feel better after they are vaccinated.
And that is definitely great news, because people with long COVID, the long-term effects are pretty awful, and the long-term effects seem to hit also young people way more, and actually young athletes. There's I believe I saw a study that high school athletes that actually had long COVID. That, I mean, basically for some of them that was the end of whatever career they had planned in sports.
That's true. It can be a devastating illness, long COVID, and we're not sure. It's probably an inflammatory condition. Nobody knows why the vaccine tends to make people, improve. About 30% of the people who have long COVID, but yeah, it can be devastating. And Tahoe Forest Hospital, I'm sure Jeff knows that, has got a clinic for folks with long COVID, as does UC Davis, a rehab clinic. So more research is needed. It probably is on the same line as Lyme disease. The people have chronic recurring symptoms that still is failed to be elucidated by medicine is what exactly the cause, and we really don't have a very good treatment. So that's another reason, please get immunized. Don't get infected.
And with that, I think we got through our questions, both the email questions and our audience question, unless anybody from our audience has a question. So then if you do, please put that in the chat or in Q&A. Otherwise, I'm just gonna hand it back to our panelists for the famous words of wisdom before the holiday weekend.
I'll dive in.
Jeff, go ahead, Jeff.
Yep, I'll dive in. We're just reminding our families and our students to continue to be diligent and mindful of mitigation measures this weekend. It's one of the things we notice with a lot of our high schoolers, especially with like after school events and parties and house parties or sleepovers, especially those that are under the age of 12 who have not had the vaccine, just to be mindful of that. We want to keep all of our students and staff safe, keep our doors open. So enjoy yourselves, but just be mindful of your gatherings and that sort of thing, especially if you have not received the vaccine.
I would say, definitely go out and get vaccinated. In terms of gatherings since the very beginning of this pandemic have been a key source of spread. And the last thing we want to do is kick ourselves backwards right at the end. So be very cautious over this weekend. Just because our COVID cases are down doesn't mean that they're gone. And go out and get vaccinated so that you can start gathering safely without fear of causing an outbreak.
Okay, so I'll go ahead. Absolutely. Remember that gathering outdoors is better than indoors. It's safer than indoors. If you're going to have indoor gatherings, no more than 3 households, wearing masks and social distancing if not everybody is vaccinated. And just a reminder to young people, having received the first dose of the vaccine doesn't mean you're fully vaccinated. So you are not fully vaccinated. Most kids have not been fully vaccinated yet because we just started vaccinating this month. So you are still susceptible. Still wear your mask, still social distance until you're fully vaccinated, which is 2 weeks after you've received your second dose of the Pfizer or the Moderna vaccine, or 2 weeks after you received the single dose of the Johnson & Johnson vaccine. And I see in the question and answer, someone wanted me to repeat the 2 treatments, after which you should wait 90 days for COVID-19. And the 2 treatments are monoclonal antibodies, which is the most common treatment for people who have COVID-19 that are at risk for complications, or convalescent plasma, which is not as commonly given, but occasionally is. Scott?
Okay, thanks, Glennah. Hard act to follow. Anyway, on a physician call, a quote came up from Carl Jung. Everything that irritates us about others can lead us to an understanding of ourselves. And so we have plenty of opportunities for us to understand ourselves better. And I would just hope that, we see people that are, kind of different, ends of the spectrum politically, or maybe attitudes toward vaccines. But, I would say, again, this is a pandemic that knows no boundaries, no borders, and affects us all. So hopefully the result, we come together and we work together to not only conquer this virus, but to take on other things. So anyway, so remembering irritant can be a path to self-improvement. So thanks.
All right, with that, thank you, everybody. Have a wonderful Memorial Day weekend. Be safe, everybody. Enjoy. It's going to be hot. So hot, that means hydrate often today and tomorrow. So keep doing that. Wear your masks. It's not June 15th, and it's totally okay to wear a mask. With that, have a great weekend. Thanks, everybody. Bye.